Welcome back to the AM Club, coming to you live from our Silicon Square studios here in East Legon. We're having such a great time, and it's now time for our Lifestyle Daily segment. And in line with our breast cancer awareness campaign, which we call Crux It Out, we'll be talking about breast cancer with specific attention to the genetics of it. Now, October is Breast Cancer Awareness Month, as you all know, and this is marked in countries across the world and helps to increase attention and support for awareness, early diagnosis and treatment, as well as palliative care for women facing this disease. But like many other women in the developing world, the practice of breast cancer screening among Ghanaian women is quite unsatisfactory. As a result, many cases are diagnosed at advanced stages, leading to poor outcomes, including mortalities. Early diagnosis remain the cornerstone of breast cancer control. When found early, and if adequate diagnosis and treatment are available, there is a good chance that breast cancer can be cured. If detected late, however, curative treatment is often no longer an option. In such cases, treatments may improve quality of life and delay disease progression, while supportive and palliative care should be readily available to relieve suffering for patients and their families. Now, as much as there is usually a lot of buzz about breast cancer in the month of October, there still exists a gap between awareness and the practice of breast cancer screening, which is usually because some women feel fit and healthy and do not think they are at risk of developing it. Other studies also suggest that other women don't go for screening at all because they are afraid of being diagnosed with breast cancer. Edma is standing by with a big conversation. Edma?
Yes, so before we get into the conversation, remember you are a major part of the show. So do send us your experience via our WhatsApp number at 0550331511 or tweet us at MX24GH with the hashtag DAM Club. So tell us, have you been screened yet? Let us know. Or do you know anybody suffering from breast cancer? And of course, joining me on this conversation, I have Mkpouto. Yes?
Yeah, you got it.
So Mkpouto Pius, who is a medical geneticist and co-founder of Biomaces. Okay, so welcome to the AM Club.
Thank you very much.
Okay, so today I just want everybody to be educated when it comes to breast cancer. I mean, every single year in October, we create awareness when it comes to breast cancer, and we try to get as many people, both men and women, to get themselves screened. But like Godwin just mentioned in the introduction, the rate of women being screened every single year is quite low, and it's because of many reasons. Some being scared, some thinking that they are fit, so you know they don't need to get screened, and some also thinking that, you know what, we don't have anything like that in our family, so why should I get myself? Why should I be the first person to even start this? So today we just want to educate everybody that, you know, prevention is better than cure. So just make sure that you go out there and you get yourself screened. So let's start the conversation by understanding what are the causes of breast cancer.
Yes, so breast cancer, like any other kind of cancer, doesn't exactly have one cause. So it could be caused by a myriad of things. So typically, your genetics contribute to it. So if you've had a mother, a sister, an auntie, someone in your lineage who's had breast cancer, the chances are very high that you may have it because you may be carrying the genes that predispose you to breast cancer. So there's two genes that are most important in breast cancer, and they're called breast cancer 1, that's BRCA1, and breast cancer 2, BRCA2. And so usually if you were to go to your doctor and say, I have a mother, or my mother had it or has it, or someone in my family has it, your doctor would likely recommend you to a genetic counselor who will then will recommend a genetic screening. What that then does is check if you have the genes. If you have either or both of BRCA1 or BRCA2, then it means that your chances have increased very high, that you may have breast cancer at some point in your life. So what they'll do is then recommend more frequent screening and checks just to catch it when it starts to develop. But beyond having inherited the gene, some people say, well, no one in my family has it, so I don't have the gene, so I'm not going to check. But the thing is, sometimes we have what we call spontaneous mutations, which means that your genes have changed in your own lifetime. You didn't get it from your parent, but it changed in your own lifetime because of things like your lifestyle choices, for example. And by lifestyle choices, I mean, we're starting to live a very westernized lifestyle. You know, we're using the microwave more often than just, you know, the way our grandparents cook their food. We're, you know, using the photocopier. That's radiation passing through our body. We're doing so many things that exposes us to radiation. We're eating canned food off the shelves. You know, that quick life that we're getting exposed to means that we have our lifestyle choices have changed and our genes recognize those things. So you may have picked up spontaneous mutation in your own lifetime that you will then pass on to your children. So that means that you owe yourself and your generation to come a responsibility to check. So
because it always started from somebody.
Exactly, starts from someone.
So if your great-great-grandmother or your grandmother or your mother had it, I mean, it probably started from them.
Absolutely.
And they passed it on. Okay. So now you just broke down the genetics when it comes to it as well, and you also mentioned certain few causes as well when it comes to our lifestyle, using technology or machines that has radiations.
Right.
When it comes to okay, do you know what? Before I even ask that question, I remember one time I was watching a movie, and then you know how these market women they like to put money in their wrappers, you know, or put their phone inside their bras, or put money inside the bras and stuff like that. Would you say that's also can cause breast cancer?
Yeah, so it's not, it's like I said before, it's not one thing or the other. It's a myriad of different things. One thing you need to consider is anything that introduces chemicals that your body isn't used to has the potential to change the genetic sequence in your cells. So things like money is made from chemicals. When you put money in your bra, you're exposing it to your cells. Your skin absorbs these chemicals over time.
Yes.
It doesn't start in a day or two. People say, oh, I've been putting money in my bra forever, I haven't had anything. It may not start with you. You may acquire the mutation and pass it to your children. So that's the thing. Things that even, you see, small things, even with body spray. Perfume. Those are made from chemicals. You know, so many things we use daily. I mean, we can't stop using these things, but we need to mitigate the risk that come from using these things. So even your phone has radiation. That's why they say when you're sleeping, don't keep your phone. You know, it's a habit to just use your phone and fall asleep.
Sometimes even me, I even fall asleep. And it's in my hand, and I'm just like,
exactly. Your phone is emitting radiation towards you. Sometimes they say, don't put your phone in your breast pocket. Don't keep your phone a certain meters away from you while sleeping. You're picking up radiation. So those things accumulate over time and eventually become a problem. So yeah, those lifestyle choices absolutely contribute.
Wow. Okay. So now, when it comes to screening, at what age or at what time in your life do you have to go and get yourself screened? Because I mean, not to change conversation, but then I know that, for example, in the UK for cervical screening, you have to be around 25, and that's the age that NHS sends letters to all women to go and get themselves screened. But when it comes to breast cancer, is there a particular age as to when you need to get yourself screened?
To be honest, prior to a few years ago, the expected age for onset of breast cancer was 60 years and above. So that's why people would say, oh, breast cancer is a disease of age. So I wouldn't worry. I'm just 30. I wouldn't worry myself. But, you know, just like you said, in the UK, there's a lot more, there's a conversation around personalized medicine, personalized screening. So we know that we start screening people at, I think in the UK it's 50, but the conversation is to start early for people who are at increased risk of having it. So right now there isn't exactly an age. Exactly. Right now it's about one of the greatest risk factors for breast cancer is being female. Men and women can have it, but the greatest risk factor is you're female. So all you need to push you to go get screened is if you're female.
That's it, exactly. That's a reason enough for you.
Yeah, but men too should get screened as well, because men get breast cancer. The statistics shows that a percentage of men get breast cancer. So well, people should be getting screened.
Okay.
Absolutely.
All right. So now, when it comes to patients who eventually have been diagnosed with breast cancer, some of them wait till very late before they start treating it. Do you think there's a reason for that particular behavior?
To be honest, it's fear. It's fear. You know, people are thinking, or people are trying to delay the inevitable. That's the best way to put it. You know, trying to put it off to say, and some people are living in denial to say, I can't have breast cancer. I'm going to do something. I mean, you know, when some people think, okay, well, maybe I'll pray about it and it will go away. But you know, faith helps us out. Faith works, but there's some things that you need to face the reality. Especially because breast cancer in itself is not a death sentence. It is how it is managed that becomes the problem. I think at this point it's important to say that breast cancer happens in stages, and the stages just simply represent the speed of travel of the cancer. So how breast cancer typically starts in the breast, so usually in the ducts that produce milk or the surrounding tissues, and then the cells, because breast cancer is formed when your cells no longer understand the command to stop dividing. So those cells keep dividing, gets the breast enlarged. And when that place no longer contains it, it detaches and starts to spread through the blood, through lymph tissues. And then they spread to other regions. So when breast cancer is still in the breast, which we call like local breast cancer, that's the best time to start getting treated. When it starts to metastasize, meaning when it starts to migrate to organs where nobody wants to touch, that's when you start hearing stage 4.
Yeah.
Which is when it is very highly likely that no one can do anything to help.
Okay, so now let's talk about the stages. I mean, you just mentioned that there are different stages to it, like any other cancer, really and truly. So now let's start from stage 1, 2, 3, and then 4. You just mentioned that stage 4 is when it's final. I mean, it has spread across your body, and doctors or surgeons wouldn't really want to touch these organs because it's just you know. I think that's the time that maybe you have to really start chemotherapy.
Chemotherapy.
Okay, so now let's talk about the first stage, second stage, third stage, and then maybe the fourth one, we leave that out because we just spoke about it.
So essentially, usually how breast cancer is categorized, there's different ways and reasons why breast cancer is categorized. But like I said before, when breast cancer starts in the breast, and we call it like it's still local. So that stage is usually still stage 1 because once you see it, you can just take out those cells. Usually, sometimes people just take out the breast, what we call a mastectomy, to stop the cells from spreading anywhere else. At that point, you're very likely stage 1, early stage 2, and something can still, it's very highly, that's when you start getting hormonal therapy and all of that kind of thing. When it starts moving from local to regional, what it means is that it's no longer where it started. It's moved, but it's still within the breast region. And then we say it's regional. At that point, you're talking mid-stage 2. And so when it starts to migrate out of the region where it started to distant organs, sometimes you find it in lymph nodes, other times you find it in different organs. It's amazing how these things travel.
Wow.
Sometimes breast cancer starts in the breast and finds itself in the lungs, finds itself in the kidney. In places where it's really, really touch and go. So once it's spread really far, we're talking late stage 3, stage 4. So the stages, in its simplest way to describe it, just represent the speed of progression of the cancer cells from the original point where it started.
Okay, well, thank you very much for sharing that with us. So before we continue with the conversation, as part of our Cross It Out campaign, we interacted with a victim of breast cancer, and she has shared her story with us. Let's have a listen.
I randomly did a self-examination in my room one day. I was in university and my friends and I were having a discussion about breast cancer. So I just decided to check, and that's when I found the lumps. As to what caused it, it was never really fully explained to me. When I went to the hospital, I did some tests, and the test came out and it said the lumps weren't cancerous. It was explained to me that sometimes it appears normally in some women. And then, but even though it was not cancerous, it still had to be taken out for precaution's sake. As to how I felt before the surgery, I was pretty calm because my doctor really did a good job in calming me down. It wasn't a difficult procedure. I would be fully awake. I won't be under full anesthesia. They just needed to cut and remove it out. And same during the procedure as well. He made sure I was calm. I was fully awake. I was talking to the doctors and everything. The amount I paid for the surgery, I believe it was around 6,000 Ghana cedis. Yes, as at that time, that was in 2018. So when they did my surgery and when they cut me open, unfortunately, they didn't find the lump. The lump just disappeared. And it was bizarre because before they cut me open, the doctor actually felt the lump and marked the place before he opened up to take it out. We didn't really understand why there was no lump, but just explained to me that they didn't find anything. If it appeared again, which it did along the line, they'd have to do a surgery again. It took me about a month to recover from the surgery. I used to go weekly for checkups and cleanups of the wound. Honestly, what I would say to other ladies out there is to habitually do a self-examination. It is better to do a self-examination so that you can be detected early and treated early if it is cancerous. So it is important that you always either go to the hospital for a breast screening or always, as and when you can, always do a breast examination to check whether any lumps are formed.
Okay, so that was a little testimony or a little experience shared from a victim of breast cancer. But my worry when it comes to listening to that was her mentioning the cost of the surgery. Would you also say that that plays a part as to why people just, leave it till it's stage 4 and they eventually cannot do anything about it and it kills them? Because 6,000 Ghana cedis, I'm sure not every single or the average Ghanaian probably cannot afford that. So would you say that the financial side of getting, it removed and all of that also plays a part in terms of women not even wanting to go to the hospital?
Absolutely. When it comes to, the financial cost depends on what they find and what procedure needs to be done.
Okay.
Because with screening now, there's a lot of people partnering to provide free screening, free regular testing, etc. So that itself is not very expensive. But when people find that there's something and then they're referred for treatment or management procedures, then it becomes expensive. And like you said, the average Ghanaian may not be able to afford it. And so, that itself contributes to what puts people off. So, but breast cancer is a topical issue, and I believe that we're getting to a point when we should get more stakeholders collaborating to make, treatment more affordable for the average Ghanaian woman.
I totally agree with you when it comes to that as well. I mean, right here at Mkpouto, when it comes to our campaign, the Cross It Out campaign, we have partnered with 3 top hospitals in Accra who would eventually give access to both men and women to get themselves screened. And I'm sure that other organizations are probably doing the same thing. But like you just mentioned, I think it would be good for organizations to come here or get together and make sure that once something is detected, the treatment that comes after that is affordable for everybody. Because 6,000 Ghana cedis, it's a lot of money. That was just for the surgery. I'm not even talking about maybe the medication that has to come after the taking of drugs and all of that. So now when it comes to treatment, I know that there are different treatments for whatever stage that you're in. So let's talk about the stages and what treatment goes for whatever stage.
Usually the first line of treatment is usually hormonal therapy. And if you understand what what is behind breast cancer, you'll understand why hormonal treatment is usually the first line of treatment. So usually when they detect breast cancer, what they're looking for is some hormones. So being female, the hormones that usually boost our femininity are estrogen and progesterone. So when people have breast cancer, the progesterone and estrogen receptors are found on the cells of the cancer. So those are 2 biomarkers. But there's also another protein which is a mouthful, but for short it's called HER2. So what they're looking for mostly is those 3 proteins, biomarkers. And so when they are present, it then means that indicates that a woman has got breast cancer. So for hormonal therapy, they produce medication that targets those 3 receptors. They are receptors for hormones, and that's why those treatments are called hormonal therapy. So for early stages, hormonal therapy is usually the first option. But like you've mentioned, when it becomes advanced, then we have to do chemotherapy, immunotherapy, which is usually more strenuous for the body to deal with. Because immunotherapy, for example, also targets your immune system, unfortunately. It gets to weaken. It gets to attack, quote unquote, not just the cancer cell, but sometimes there's collateral damage for other cells. So it's a lot more, that kind of therapy puts a lot more strain on the body than the hormonal therapy. So that's usually reason why we say catch it early, so that you don't have to go down the road of chemotherapy and all of that.
Yeah, because I have personally witnessed, not for myself, but I've witnessed a close family member of mine having to go through chemotherapy, and that I think was what also made her pass away, because it was just too strong for her body, especially with looking at her age and all of that. Okay, so now let me quickly go through some WhatsApp messages that are coming in, so we can have a conversation about that. So this person said, good morning MX24, I am Mr. Ramos, watching you live from Enchi. You both look amazing, and I just want to know if it has anything to do with the topic. Okay, this has something to do with what we were talking previously. So let's move on. Please, my name is Lemani. Please, I want to know if you apply pomade on your breast, can it cause cancer?
Yeah. Yeah,
Because
yeah.
I've actually heard that a lot as well, you
Yeah.
know. Because I remember a friend of mine, she was like, "Oh, Hima, when you're creaming yourself, don't put it around your breast, no, because it can cause cancer." No, I've heard this a lot of times.
Yes, I mean, to be honest, it's really hard to say because it's not my field to talk about what cosmetic costs what. But I think it's just important to know that if things have some harmful chemicals, your body can absorb it. And to be honest, it doesn't even matter if you rub it on the breast or on your legs or whatever. If it has harmful chemicals, the chemicals will find its way to where it wants to find its way, you know. So it's not exactly directly if you rub it on your breast. So the important thing is just to say, just be mindful of what you buy,
Probably
check
like
that it exactly read. I think we don't really have a culture of taking things and looking at the label. What does this mean, you know? So we should be more careful about what we are buying, where it's coming from, be sure it's not fake products. Just try your best to use authentic products as close to as possible to nature, and that should be helpful. Yes.
So this person said, MX24, I didn't really wake up to a great start of the day, but with you guys, I am feeling great already. Well, thank you very much, and I hope that we are still making your day. Great discussion on MX24. Thank you for the awareness. I didn't know that men can also suffer from breast cancer. Well, there you have it. I'm happy that you've learned something today. And this person said, good morning. I am Brainy inside Hollywood barber shop at KJB. Whoa, the woman is too amazing. In fact, I really love her dressing code too. So I want to ask her that if she is saying on point, because I witnessed it. I want to say that what she is saying is on point because I witnessed it before. But note of congratulations to all my seniors in the great Kasek at OT region. Well, there you have your shout out. So this person said, I have a burning sensation in my nipple area and sometimes pain. Is it a cause of breast cancer?
Some of the symptoms we've seen for breast cancer typically would include like pain around the breast area, inverted nipples. So usually the advice is if you find anything that is not right, because you've had your breast for as long as you've had yourself, you know. So if you find anything that isn't right, don't sit on it. You need to see a medical practitioner to check it and diagnose what it may be. You know, so I would say get it checked out. If it's uncomfortable.
There you have it. Please do get it checked out. Okay, let me take one more. This person said, good morning, I'm Kobe. As always, please, a question to the guest. Will men also go through surgery if they also feel something in their breast, like how my brother Isaac of MX24 has built his body? I can't even read that. But so do men also have to go through surgery if they find something in there? Yeah,
to be honest, if cancer is cancer, if it needs to be removed, it needs to be removed, regardless of the gender. You know, sometimes someone can have, so the reason why it looks like, oh, men aren't having a lot of breast cancer is because, unlike us, they don't tend to have dense, well-advanced breast tissues. But breast cancer can start in the breast and present itself somewhere else. But it may still be diagnosed as breast cancer because it started in the breast. So wherever it poses the greatest danger, something will have to be removed. If it's a lump, if it's, you know, the tissue itself, you know, it'll have to be removed. So regardless
and is it, if for example is a first stage for a man, would they have the same treatment as what is given to women?
It depends on what is found. So you see, when I said for us, the estrogen, progesterone, those hormones, if the receptors are found on the breast cancer cells, or the biomarkers that normally should be present in a normal person, but they're found elevated, what they'll try to do is suppress it, give you hormonal therapy to suppress it. So if the same hormone receptors are found in men, same thing will have to apply. You'll have to get the hormonal therapy to suppress it. So it's a function of what is found and what will act against it. And that's just how it works.
Okay, well, there you have it. Thank you so much, Mkpouto. Yes? So there you have it, Mkpouto Pius. She's a medical geneticist. Did I say that right?
Yeah, you did.
Geneticist.
Geneticist, you did.
Okay, and she's also the co-founder of Biomasses.
Yeah, correct.
Okay, so today on Lifestyle Daily, we had a great conversation and we tried to create more awareness on breast cancer. I hope that we were able to educate you in terms of why you should go and get yourself screened. And as part of our campaign here on MX24, which is called Cross It Out, we will be giving you more details on all our social media platforms at MX24GH. So do make sure you stay tuned and find out what are the 3 hospitals where you can go and get yourself screened and also win some fantastic prizes as well. So you're not just going to get yourself screened, you're also going to win something while getting yourself screened. So let's now move on. Thank you very much for coming, my lady.
Thank you for having me.
And officially, you're a member of the AM Club. Let me just put that out
thank
there.
you.
Okay. Thank you very much. So